former NHS Trust Chair, Martin Gower. Good morning, Martin.
Morning, Kevin. Nice to talk to you.
Well, nice. Always nice to talk to you, Martin, but this isn't a very nice day, is it? This is unprecedented. A synchronised strike between consultants struggling by on £145,000, £150,000 a year and junior doctors. I mean, there's only one reason they've coordinated this walkout. That is to harm patients, isn't it?
Yeah, and I rather think that if the government or Steve Barclay or Rishi Sunak or somebody doesn't get round the table as they're requesting, these will go on, and I think they will intensify. You know, if they don't feel enough patients are dying, you know, they'll intensify it so they get better numbers in terms of deaths. You know.
It's just awful, I mean, it would be good if everyone could get round the table, but let's consider, if we can, some of the damage that's already been done by these strikes. They've been going on now since way before Christmas. Since Christmas, there have been 850,000, you know, the best part of 1 million surgeries and operations have had to be cancelled because of these strikes. One of the strikes a couple of weeks ago, 2-day strike, apparently 30,000 cancer appointments had to be cancelled, and that included some vital life-saving surgery. The effect of these strikes, even when they're not coordinated, is catastrophic, isn't it? So now we've got two sets of frontline medical workers, doctors and consultants, standing on picket lines together. I mean, the mind boggles at the damage that this walkout will do.
Yeah, and the answer, of course, is just to give in to the demands of the National Union of Doctors, you know, call themselves the BMA. And I don't think that's going to happen, frankly. There are the idea as well that they continue to say, well, all our colleagues are going off to Australia and New Zealand. Well, let's be honest, they can earn more in Australia and New Zealand, but certainly not because the ministers of health in those countries have decided how much they're going to pay their doctors. These are independent and private or charitably supported organisations, and they negotiate locally with their own within their own organisations. And indeed, that the idea that you give blanket percentages to any group of workers, irrespective of individual performances, to me is just something that belongs in history.
Indeed. Now, you and I have spoken about this before. I think we're at this point. Well, now that they're starting to coordinate, to synchronise these strikes, you know, deliberately to damage and to compromise patient safety, to essentially stand on picket lines while their patients are dying back in the hospital behind them. It surely is time. If they're going to carry on like this, and they're demanding 35%. Why do you demand 35%? Because you don't want a solution. You want to carry on striking to cause problems for the evil Tory government. This is politically motivated. So if they're going to carry on like this, it must be time for the government to start considering adding to the list of professions that aren't allowed to go on strike, as in the police, as in prison officers, as in the armed forces, frontline medical workers. It must be time to start thinking about banning these people from walking out of hospitals and patients dying because of that.
Yeah, I mean, I think that's something they need to consider. I'm not awfully fond of the idea, frankly, of banning strikes among doctors. But it's part of this sort of monolithic structure that we have, that we might want to do that, because our health system, sadly, is run by politicians and not by healthcare management, and as they are in other places. I mean, I think the other thing, of course, is for the consultants, this has been a grand opportunity for them to do some more private work while they're on strike.
Yeah.
So while they damage the NHS, a number of them are being able to feather their own pockets by doing more private work. Indeed, I've heard of an example recently of somebody who quite recently decided to go private for a hip replacement. And the doctor said, well, what are you doing on Thursday, you know, or Wednesday? And they came straight in. And interestingly, it was one of the days they were going on strike. So, yeah.
It's extraordinary, isn't it? It is extraordinary. I mean, it's like they're kind of feathering their own nest, because by making the waiting list longer by going on strike, more and more people are getting together what money they can to go private, and guess who they see? They see the consultants who are on strike. So make of that what you will. Martin, excellent to talk to you as always.